2 years ago, we adopted the electronic health record. A friend of mine, Dr. Capel in City View, had gone through this process some 6 months before then, and he had adopted a method of recording the visit with a scribe in the room and recommended that I consider doing that. And so with that in mind, I took that process and have 2 nurses now. They're both LVNs, but several of my partners have adopted the same process and used MAs, and that's worked very well for them. And we have these ladies that actually room the patient, prepare the patient for our visit, and they keep up with the record during the time that we're in the room. There's occasionally conversations with the scribe as to the exact diagnosis, so it's recorded correctly in the CPOE. Probably give her about 20 in a refill. There also is an opportunity for the scribe to produce prescriptions, order x-rays and lab, physical therapy, referrals and so forth. It relieves me to be able to focus on the patient and spend my time with direct conversation with them other than the time that I do address the scribe in order to help her with the correct recording. In the evenings, I review all the notes from the day, and at times I'll change a little bit as far as the way things are said. Overall, the process works extremely well in the sense that all the major part of the information is in, as well as it helps to improve our flow. I know a lot of people are concerned about the expense of a scribe, and Dr. Capel had already looked into this before he hired one, and I've sort of verified the same thing. It requires seeing 2 extra patients per day to cover the cost of an extra person in the room, and it is extremely well worth it. I don't think those 2 extra patients, if anything, probably create even less time in the total day's work. And they allow a lot more comfort, a lot more enjoyability to the practice, being able to focus on the patient rather than on the electronic health record. It increases my efficiency. Probably more than anything, it helps to reduce my anxiety that I may miss something or forget to record it. I think overall it's actually improved patient satisfaction because our patients many times will have an opportunity during their time in the room before I come in to visit with the nurse and talk about some of their health issues and just life in general, and they seem to be very satisfied. And that was a concern that I had because for the first 29 years of my practice I did not have anyone else in the room unless I needed a female escort for a female exam. And I was afraid that it would inhibit patients from feeling comfortable talking directly to me. And in that regard, when I have someone who has any discomfort or problem at all with the scribe in the room, I ask the scribe to leave, and then I just do a transcription to the scribe after the patient's gone. But that is extremely rare. Maybe once every 3 or 4 months I'll have someone who requests anonymity or just an opportunity to visit with me by myself. In family medicine, it's not uncommon for people to come in with a primary concern but have some ancillary concerns on the side. And many times when you're trying to address multiple issues, especially in a very short time frame, it's difficult to get each issue down correctly. A typical example would be a patient who's here for diabetes, dyslipidemia, and hypertension, which is a common trio of diagnoses that we see each day. And while they're here, they have the proverbial rash. Oh, by the way, doctor, what's this rash? And you diagnose the dermatitis in your mind and fix a quick prescription for a steroid cream. And yet, so frequently in the past, even with the handwritten records, there would be no diagnosis to explain why the cream is there. The patient calls back 6 months later, I need another tube of the cream. Well, what cream was that, or why was it even given? With the scribe in the room, she forces me to make a diagnosis on each malady that we may write a prescription for, do laboratory, x-ray, referral, and therefore there's a good flow within the document because someone else is worried about recording all this. I'm really only worried about taking good care of my patient. I think the EHR has been very beneficial. It allows quick opportunity to review medications, recent lab, the entire document is much easier than the paper record of flowing through and looking at page to page. I think a scribe makes this a whole lot easier. I think it would be difficult to spend a great deal of time trying to type on the computer and address the patient's problem at the same time. And therefore, a scribe has made all the difference in the world for me.